In this cervical soft tissue technique, patient lies supine, and we're going to be utilizing a unilateral traction technique. So we're going to be calling it contralateral traction technique, just for descriptive purposes. In this technique, I'm going to be using my hand that's able to reach across and contour over her forehead, and then my hand that's more close proximal to her pelvic area is going to come up and reach just behind the posterolateral musculature. And I'm going to try to palpate in that little groove for the articular processes so I can get behind those muscles and, again, sort of contour but tent up. I'm not on the spinous process. I'm just lateral to it. And with this, I'm just going to keep my elbows straight, and I'm going to lean back with my upper body so that you can see how my hand rises superiorly off the table. Now, if I didn't do anything with this hand here to counteract that, then her head would turn over. So I'm trying to keep her head straight. So what I'm going to do is I lift up with this hand. I'm going to simultaneously just give a slight push to this same side so I keep the head steady. And then I can just come up, and again, you see there's no sliding. And if I want to get a different part of the head and neck, I just reapply my hand, lift and reapply, and just contour. This tends to be a very popular technique from the patient's perspective, and tended to be a technique I used to do very frequently in my earlier days of practice. But then as I got lazy, examining the patient's neck in the supine position, I just stayed supine in the seated position for myself. But this is a really good technique. It really can get into an area, isolated tension, and work it. The thing you must be careful about with this technique is to not jiggle the head back and forth and get the patient dizzy. So it's just a slight little pressure into the head just so that the patient's head doesn't rock back and forth to help stabilize it. So contralateral traction technique.